Hi guys, welcome back to my channel where I'm talking all about my injury and helping you get the help that you need to deal with this injury. At the end of my last video, I talked about how I was heading to the Vincera Institute in Philadelphia and how that's where I was planning on getting surgery and going on the final injury recovery of this, hopefully. If you haven't seen that video, definitely make sure you check that out first because that's where I explain everything that's been going on with me. So I just wanted to do a follow-up video explaining what happened since then because a lot has happened, and I know a lot of you are probably wondering what happened because this is the important part. You now know I made the decision, but what happened? That's what you want to know. That's what I always look for when I'm trying to find the answers to my own pain. So I just wanted to go through my experience over the past 4 months since my surgery, what it was like going to Philadelphia, and everything that happened because it's a lot. So it all started out, it was right in the middle of COVID-19. So we sort of planned a flight and the surgery with the hopes that it would happen. And actually, we were able to make it work. We had to get a bunch of clearance from jobs and all of these things, but we made it work. So we flew out to Philadelphia the weekend before Cinco de Mayo, because I had surgery on Cinco de Mayo. That's how I always remember. It was May 5th. We flew on Sunday, arrived Sunday night, and we woke up early Monday morning to go to my appointment. And I would say we were going into this whole thing just very optimistic. I was excited to be there. I was so excited that it worked out. I was so excited to finally get the answers and to finally see the doctors who know what they're talking about. And I was honestly kind of hyper. And I'll show you some of the videos right here of kind of what the energy was at this time in the recovery. We're in the waiting room. He already came in and did some tests and he said, well, I'm gonna go look at your MRI. What the? Danny's been playing with all this stuff in this room. It's not very good. But he said he's gonna go check the MRI one more time. And he's been gone for so long, so I'm just a little nervous. This is what Danny keeps doing. Stop it. It's not a toy. So as you can see, it was very lighthearted. It was fun. Me and my husband are having a good old time laughing at the doctor gear. And I think a lot of that laughing and goofiness was coming out of anxiety. For me, I become really lighthearted when it's really not lighthearted because it almost helps me cope with it better. While I was waiting for the doctor, I would say my biggest fear was that they would say it was worse than what I thought it was. So I went there expecting to get surgery on my sports hernia, athletic pubalgia, core muscle injury, whatever you want to call it. And I expected them to do that surgery, which is about a 6 to 8 week recovery. It's supposed to not be nearly as intense as my previous hip surgery that I had last year. So I was going in with high hopes that this was just the final step. It'd be quick, it'd be easy, and I'd be on my way back to dancing. So I'm waiting. I'm acting all giddy and anxious, joking around, but in my heart and in my mind, I am so nervous that they're gonna tell me there is a problem that's worse than I thought. Sure enough, that's exactly what happened. My biggest fear came to pass. When the doctor came in, he sat me down. He was very somber and he said, you know, your abdominals, I'll show you where it's torn, which is what I expected. And then he said, and here's your hip. I think your hip is the main problem still. And I'm gonna bring in our hip doctor, our hip specialist. He's one of the best in the country. He's gonna talk to you. My heart sunk and I felt so heartbroken already because those were the words I didn't want to hear. I had been told your hip is good, it's just your abs that need to be fixed. And then I come all the way to Philadelphia to see the best doctors in this field and they say, your hip is not good and you also need to get your abdominals fixed. So that was dramatic. I was heartbroken. I immediately burst into tears. And what was so great and what immediately told me that I was in good hands was Dr. Myers, who's the main guy at Vincera Institute. He is very well known, really famous for his cutting edge surgery that helps people like me. And he just like put his hand on my shoulder and looked me in the eye and said, "It's gonna be okay. We're gonna help you." And that was like just the best thing ever. And it honestly made me cry more, which you can see it's bringing up emotion in me now, because to have a doctor who cares about you is like so hard to find. And that was something that I was searching for. Someone who genuinely wanted to help me. And I felt that he genuinely wanted to help me. So of course, Dr. Coleman, he's the hip specialist. He comes in, he shows me my MRIs, and he says, "Yeah, your hip is not looking so good. I know you already had surgery on it, but it looks like your previous hip surgeon might have missed something, and that's why you're still having so much pain." So my previous hip surgeon reattached my labrum. So when you're in your hip socket, this is the head of the femur, and this is your, like in your pelvis, the ball and socket joint. You have a little piece of tissue right here that's called your labrum. And for me, my labrum had torn away, which was causing a lot of pain and dysfunction for me. The problem was I had a big bony growth on my femoral head. So every time I was moving, it was just tearing at that labrum. So what my first doctor did is he reattached the labrum, and he said he shaved off some of the impingement, which is what this was. But apparently there was a whole nother section of that impingement that hadn't been treated. So of course, as soon as I started moving, it just once again tore the labrum back off again. And I was like, are you kidding me? Like, this surgery is a 6-month recovery. I had been in a whole year of pain and frustration, and one of the hardest years of my life overcoming this surgery, and that surgery was a failure. As you can imagine, I was distraught. And to the point that like I was in tears, and the doctors would come in and I like couldn't even look at them in the eye. And I wouldn't let myself make any decisions in that point. I thought, I just need to get through these appointments, and I need to like calm down, and then I can step back and decide, okay, what am I gonna do to help myself overcome this? Okay, so that was Monday. We didn't leave there. We got to the doctor's office at like 7 or 8, I can't even remember, and we didn't leave till like 2. We were starving. We went and got Philly cheesesteaks, which I highly recommend if you're in Philly. We sat in the car, because COVID, ate Philly cheesesteaks, and discussed what was gonna happen. And I think what we decided was we flew all the way to Philadelphia to seek care from the best doctors in this field. So if they're telling you that this is your biggest problem, we need to get that fixed. I need to get that fixed. That's something that I've been praying for. I've been praying for an answer. I've been praying for these doctors to tell me what's happening. Even though it wasn't the answer I wanted to hear, it was the answer I needed to hear. So we decided, my husband and I, and me, and I called my mom and my dad and everyone, yes, this is what you need to do. You have to do the surgery, even if you don't want to, but if you want to get better, that's what's gonna need to happen. So we tried to continue on with the rest of that day, knowing that surgery would be the next morning. And that day was like my last hurrah. We were in Philadelphia. I wanted to walk around. So we walked, and I was in pain because I was in need of surgery. So the walking wasn't that long, but it was still walking. And then I spent the night doing all the stretches that I know I wouldn't be able to do, all my favorite stretches that feel so good to just stretch out my abdominals and stretch out my hip and do all the things that I know I won't be able to do for a good couple months. I would say going into the surgery a second time is really hard because I know what I'm in for. And I was so scared of how I'd be able to endure this again, having just endured it and having not really gotten a break and just going straight into another one. And I would say this recovery, that's been one of my hardest things, is just the endurance of recovery and going through it again and overcoming it again and trying to not get defeated by the idea that feels like I'm starting over or that I'm in the same place. So the next morning was surgery. We woke up very early. It was like 6 or 7 a.m. I feel like at this point, I was actually kind of numb in my emotions. I knew it was what I needed to do and I didn't want to think about it too much. And so I got there, I filled out the paperwork, being lighthearted, cracking jokes, playing with my little IV, just trying to make my husband Danny laugh, trying to make myself feel a little better. Before I knew it, I was being wheeled into the room and I don't even remember getting past the door before I was out. So I woke up, I was in a ton of pain. Oh my gosh, it was so much worse than the pain my first time around. And I think it was just because I had so much more done. So I was just in so much pain. I, was crying for more medication, blah, blah. They got me to a stable point and my husband came in and he took some pictures of me that are a little embarrassing. I'll show you guys them right here, but I looked like I got beat up. They didn't touch my face, but my face looks like it had been through trauma. I just look sad. Just been through this traumatic surgery that I didn't want to go through. And I was done, and now it was time to recover. So we took me back to the hotel, and that day I was pretty much I was sleepy, sleepy as ever. I couldn't keep my eyes open, I didn't eat, I couldn't stay awake long enough to eat. I fell asleep on the toilet multiple times. And my sweet, loving husband just took care of me. He had to lower me down to the toilet, pick me up, lay me in bed, all the things to make sure I was comfortable. And I think I did eventually eat some soup, and now whenever I see that soup, I feel like I want to throw up. So I'll probably never eat that soup again. So that was the day of surgery. Then the following 2 to 3 days, I would say, were kind of the same routine of waking up, driving the 2 minutes over to the Vincera Institute for my physical therapy, which was with their physical therapists who are so familiar with this injury, which I was really, really grateful for. So we started very gentle physical therapy. They actually had me on the exercise bike the day after surgery, just doing really gentle hip mobilities, getting it moving. I was able to learn a little more on those couple days exactly what they did in the surgery as the surgeons came up and talked to me and I wasn't so out of it. So pretty much what they told me was, it does seem like your hip was the main culprit, but we still, had the abdominal issue as well. So yes, they operated on both. With the hip, what they did is they reattached the labrum. I have 5 anchors, so beep, 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 connecting it. And then they shaved off the impingement. And my hip doctor said it was fairly obvious what was causing that impingement and couldn't believe my previous doctor missed it. He said it was a fairly obvious problem. So, good to hear that it was obvious and that he was able to fix it, but also made me even more mad that it didn't get fixed the first time. As for the abdominals, they said I had multiple tears along my left side. So that was my rectus abdominis, which is your 6-pack muscle. It went up into the obliques, and then some of the adductor muscles, which is your inner thigh, was also tearing away and had a bunch of scar tissue. So pretty much what they do is they just pull it down and reattach it with stitches and give it some mobilization so that it won't be too limited in movement. So it was a very intense surgery. A lot was done, and I was definitely feeling it. In physical therapy, we just worked on really gentle mobility, lots of, just trying to wake up the muscles again, just simply squeezing my abdominals or squeezing my glutes or trying to lift my leg up, which was nearly impossible. So that pretty much sums up our time in Philadelphia. We were there for about, I think we left on Saturday or Friday. I can't remember. The surgery was on Tuesday. So in less than a week, I had to travel back home across the country in the amount of pain that I was in. And that was honestly the hardest day of my life. It was so painful sitting in an airplane seat, having just had a hip operation and an abdominal operation. I couldn't lean back. I couldn't stand up. They told me to stand up every hour, but in order to stand up every hour, I had to get my crutches out of the overhead bin. I had to make a scene and walk down the aisle and walk back. And it was just brutal, emotionally, physically. And the whole time I was just telling myself, as soon as I'm home, I can just start healing. I can start healing and relaxing and doing this process in the comfort of my home instead of a hotel room, which was just as exciting. So we finally arrived home, and I was just very happy to be home, crying tears of joy. And that began, I would just call this the early stages of recovery. The early stages are when I'm still on crutches. My biggest complaint with these times is just the immobility that I had and the helplessness that I had of not being able to get myself dressed or make myself food. And I was pretty much just helpless to my husband, and he needed to do everything for me. And that's just tough no matter who you are. It's hard to be vulnerable and hard to ask for help when you need it and feel like a burden on your loved ones. I would say that was the hardest part of that. Also just boredom and feeling really antsy in my body, but not being able to move and burn any energy off. I was on crutches for about 2 weeks and then slowly started easing off of them. Something that's really important about this recovery is you don't just, yay, I'm done with my crutches and you're done. That's not it at all. It's a slow process of you're on 2 crutches and then I'm on 1 crutch and then I'm on 1 crutch, but I can like walk around the kitchen a little bit and then I need to get back on my 1 crutch because it starts to hurt again. Eventually those times between having the 1 crutch and walking just widen to the point that you don't need the 1 crutch anymore. And that is probably another 2-ish weeks until I'm independent of the crutches. So I think that's something really important to note, especially on these types of surgeries. It feels like, I don't know, if you have a broken arm, you get your cast off and it's like, yeah, my cast is off and you're just free. It's not that the doctor clears you of crutches and you're just like, yeah, I can walk. No, it takes a good couple weeks to walk, and then even then, it took me a good couple months until I could walk around the grocery store or let alone like go on a walk around the block. It just takes time. The second stage of healing is when we really start to push it in physical therapy, which is, I would say this is currently the stage I'm in now, like around 2 to 3 months, which is where, you know, we're starting to strengthen the hip again, we're starting to work the muscles again. And honestly, this stage is almost more painful than the beginning, just because you're no longer on pain medicine. You're constantly aggravating it by pushing it further, by walking further, by massaging it, by doing all these things. So the pain level does go up, but the pain level is helping you heal. So it's all about this weird balance of, I need to walk in order to get my mobility back, in order to strengthen the muscles back, but it is gonna hurt. And so it's hard to know, when are you pushing it? When are you resting too much? All these things. So that's pretty much the stage that I'm in now. Complications that I've had that's a little confusing is I have had some swelling in my left side, and we don't really know if it's swelling or if it's just like a kind of irregularity in how my muscles were sewn back on, but it just doesn't feel very good in the left side. It's pretty painful still, and it's puffy, and I'm concerned about that. Still though, I feel like I'm in very good hands with the doctors. So Dr. Myers, the core muscle doctor, he's really easy to get a hold of, and he lets you just text him. Once you've been a patient of his, you can text him and ask questions. So I've definitely taken advantage of that on times when I'm worried. I've also had 2 Zoom calls with him and his assistant, and I've also had 2 Zoom calls with the hip doctor as well. So I'm definitely in good hands. I'm definitely not done healing, and I just hope that this is the final answer for me. I hope you heal, and I hope that I heal, and that we can all live happy and healthy lives. Thanks for watching.